Care of child with head injury by Hidayatullah Khan, lecturer, KMU, INS. Definition: the head injury is a pathologic process that involves the skull, meninges, or brain as a result of mechanical force. Head injury is the most common cause of death and disability in childhood. The main concern after any blow to baby's head is injury to the underlying brain, which occurs in two forms: bleeding and concussion. When small blood vessels have been broken between the skull and the brain or within the brain, bleeding occurs within this space and compresses the brain. A blow to the head may also cause a concussion, meaning the brain has been shaken up by the fall. Pressure on the brain from bleeding or from the swelling associated with concussion produces the outward signs of brain injury. Causes: the most common cause of head injury in children includes: number 1, falls; number 2, motor vehicle accidents; number 3, pedestrian; number 4, bicycle accidents; number 5, child abuse. Risk factors of head injury in children. Many factors make children more at risk to head injury. Number 1, larger head size in relation to the body. Number 2, bicycle accidents and falls. Number 3, psychological factors. Children high level of activity, curiosity, incomplete motor development, and lack of knowledge and judgment skills. Children younger than 3 years of age have a very mobile spine, especially in cervical region, along with immature neck muscles. This place them at higher risk of injury from acceleration, speeding up, and deceleration injuries. These occur when head receives a blow or is shaken. The sudden acceleration causes deformation of skull and movement of brain. Bruising of brain may occur when brain colloid crash with skull. Another result of brain movement is hemorrhages in the brain, which are caused by the shearing forces that may tear small arteries. Pathophysiology: exposed nature of head, external violence, force of impact, intracranial content or damaged, severe scalp laceration, bleed to death, primary head injury, skull fracture, contusion, intracranial trauma, and difficult injuries, secondary head injury, hypoxic brain damage, increased intracranial pressure, infection, cerebral edema. Seriousness of head injury. Head injury in children is serious because it can cause it can cause an immediate threat to child's life as well as number of complications that can lead to lifelong impairment of an individual's physical, cognitive, and psychological functioning. Prognosis for the child who has suffered with head injury depends on the extent and severity of the injury as well as complications. Types. The common head injuries seen in children are: number 1, skull fracture; number 2, linear skull fracture; number 3, depressed skull fracture; number 4, compound skull fracture; number 5, concussion; number 6, contusion; number 7, subdural hematoma; number 8, epidural hematoma. Nursing management. Health history. Number 1, take a detailed history including past medical history with details of events surrounding the injury, such as any loss of consciousness, irritability, lethargy, abnormal behavior, vomiting; if so, how many times, any seizures, activity, and any complaints of headache, visual changes, or neck pain. Physical examination. ABCs: airway; A. Airway; B. Breathing; C. Circulation. All children who experienced head trauma need an assessment of their neurological function as soon as they are seen. This include level of consciousness (GCS scale), pupillary response, and any seizures. Note: fixed and dilated pupils, fixed and contracted pupils, or sluggish pupillary reaction to light will require immediate intervention and are considered serious. Physical examination. Note: a child's spine must remain stabilized after a head injury until spinal cord injury is ruled out. If clear liquid is noted, drainage from ears or nose, notification of the physician should be done. If the fluid test positive for glucose, this indicates leaking of CSF, cerebrospinal fluid. Care of child with mild head injury. Mild to moderate or close head injury refers to brain injury without any penetrating injury to the brain. No loss of consciousness, no other injury to the head or body. Children acting normally after the injury. Provide parents with clear instructions regarding care of child at home. Explain they must seek medical attention if child's condition gets worsened at any time during first several days after injury. Mild head injury symptoms. Children may show cognitive and behavioral symptoms like difficulty paying attention, problems making sense of what has been seen or heard, forgetting things in early days after injury. The majority make a full recovery, but some may experience ongoing cognitive and behavioral difficulties such as slow information process and attention problems. Care of a child with severe head injury. Children with more severe head injury require intensive care initially until stabilized, focused on maintaining ABGs, arterial blood gases, maintain airway, monitor breathing, circulation, and neurological status closely. Okay, preventing from seizures and treating any other injuries that may have occurred as a result of trauma, fracture to other body part. Viewers, you have watched my lecture, and we will start next step. Wait for the next session.